You're welcome to Consulting Room 5 with me, your host, Dr. Sue. Today we are talking about cervical cancer, and it's one of the most preventable forms of cancers. Yet, most of us lack clear information on how it's developed, how we can spot it early, and how to prevent it. Let's be honest, most of us didn't grow up talking openly about cervical health. Today, we are changing that. No shame, no fear, just real information about what every woman needs to know, from HPV to screening, in a simple and judgment-free way. So stay tuned, don't go anywhere. We'll be right back after the short break. You're welcome to Consulting Room 5 with me, your host, Dr. Sue. Today we have a special guest with us. He is Dr. Ayete Labi. I hope I got it right. Yeah, he's a specialist in obstetric and gynecology. He's a fellow in training in reproductive health and family planning in Kolaba Teaching Hospital. And so, obs and gynae, which one comes first? Obstetric?
So in this part of the world, it's a doubles.
Doubles,
Some
okay.
parts to separate them, but here we do together. So it's obstetric and gynecology.
I hope I got the name right.
Yes,
Ayete?
you did. Yes,
Labi?
very good.
Ah, good. Because I always call you quick, so I just... Anyway, you're welcome, sir.
Thank you very much.
You're welcome. Yeah. So this show is proudly brought to you by Lozati lozenges. You got a sore throat or dry cough? Don't let it slow you down. Reach for Lozati lozenges. Lozati brings you fast, soothing relief with delicious flavors like ginger, honey, and lemon, peppermint, orange, and the bold new cola. Watching your sugar, we've got you covered with sugar-free strawberry and sugar-free propolis. Perfect for people managing their sugar levels. Whether you are talking all day, working outside, or need comfort on the go, Lozati is your reliable companion. It's available now in pharmacies and shops nationwide. Lozati lozenges, relief that works, flavors you will love, and options that care. Have you heard of Kivo hot pepper?
Yes.
You know that?
Yes, I have.
Anyway, it's the new pepper in town. Kivo hot pepper is the new pepper. It is now easier and faster to cook. Those spicy, delicious meals you love with Kivo hot pepper. You will feel the heat and delicious taste in every meal made with Kivo hot pepper. Get yourself some Kivo hot pepper today. Use it for your noodles, spaghetti, shito, stew, soup, you name it, and thank me later. It's available in various pack sizes that is convenient for homes, chop bars, restaurants, students, and many more. Kivo hot pepper. Moko show. Anyway, obstetric and gynecologist, Dr. Ayete, how are you?
Fine, thank you.
So January is cervical cancer month, right?
Yes, it is.
But people don't like to talk about cervical cancer. Why is it so?
Well, you should understand that it's a cultural thing, I would say. Our people, sexuality, it's not a very common talked about topic. And you know where the service is located, so it is not going to come up for this.
Where is the service located?
So the easiest way to describe it, we'll call it the mouth of the womb. So where your uterus, the womb, the beginning bit is the cervix. That's where the baby comes out from. And that's also where the sperms pass to go and meet the egg.
Oh, it's the mouth of the womb.
Yes, please.
Ah, that sounds
that's
good.
an interesting way to put it, yes.
Yeah, sure. It's very interesting. So what causes cervical cancer?
Well, like all cancers, it has some associations and some causes. And we've noticed that for you to have cervical cancer, you must first have a virus called HPV that would cause some changes on your cervix. And when these changes become abnormal, then it leads to cancer. Obviously, the virus alone does not cause cancer. So we said there are some associations. And we'll talk about these along the way so you know what puts you at risk of cancer and whatnot. There are some that we call modifiable, which are things that we acquire along the way. And there are some that we cannot. And there are some by virtue of our medical conditions may make the conditions worse or better. But I hope we'll get time to talk about all these things along the way.
I hope so too. So HPV, you mentioned something like
Yes.
that. What is it about?
So HPV is a virus. And
It's HPV.
So it stands for human papilloma virus, all right? And it is a common virus that is found everywhere. We say it's ubiquitous. It is, however, commonly sexually transmitted. So majority of the time it is sexually transmitted.
Okay.
That being said, you can also acquire it asexually. And so it is not only those who are sexually exposed that are at risk of HPV, although, like I said, the majority is through sexual exposure.
Okay.
Now, HPV has a predilection for epithelial cells, so it means it attacks epithelial cells. And epithelial cells are found everywhere. And the common misconception is that HPV is for the cervix. Epithelial cells includes the tip of the penis, the vagina, the cervix.
The cells are something like this, right?
Yes, the cells are anything that line. So epithelial cells are the ones that line most of our organs. So if I look at our mouth, what lines are inner line of the mouth, what lines the cervical, what lines the penis, the anus, the vagina.
Right.
So any of these epithelial cells can have HPV.
Okay.
And when HPV attacks these cells, we can clear it. 90% of the time we would clear the virus. Persistence is a smaller percentage. But when they do persist, then they can cause these cells to undergo what we call dysplasia. And when these cells undergo dysplasia, they turn into cancer. The interesting thing, which I'll talk about, is that it takes time for us to move from normal cells to dysplastic cells to cancer cells.
Okay.
If we look at the cervix itself, it will take us about 20 years to move from a normal cervix to a cancerous cervix.
Okay.
So literally we have a gap in there where we have what we call pre-cancer cells.
Okay.
And it is that we target for screening, to look out for those cells. And so
within the 20 years?
Within the period,
so
yes.
we can see what's on the screen. So what is it on the screen?
So this, on the screen, we are looking at the human papilloma virus. That is actually the
HPV.
The type, the picture of the HPV virus, all right? And it is this picture that I said that can cause the changes, the virus that I said that attacks the cervical cells, and they will cause the changes. Okay. So you would realize that if you do get the virus and you don't clear, and it persists, and it now causes changes, then those changes can eventually lead to cancer. So
how do you clear that?
The body self-clears it. The body has a way of fighting infections by itself, and there are ways we can also help, which we'll also talk about as we go along the way. And what I always say is that, I mean, we have time. As having worked for a few years in the field, I think we should shift the focus right now from the cancer, which is preventable, to the pre-cancer. Because unfortunately, if you do get the cancer, then the whole cure that we are talking about is not possible. We can only manage you. The cure is possible if we catch the disease before it gets to the cancer stage. And the reason why we are saying cervical cancer is preventable is because, like I said, we have between 1 year all the way to 20 years to find the problem and treat it before it gets to the cancer.
Wow. So you have a grace period of working around it, looking at what it is. And so at what age should we do this HPV test?
So there are several ways in which we look for the problem, all right? So we said there are what we call screening. So screening is normally referred to when you are trying to find the problem before it becomes a problem. And we only screen things that we can do something about it. So when we say we are screening for cervical cancer, you should be happy that it means if we do find something, we can do something about it. It's not the end of the world, all right? And there are several screening tests, from what we call visual inspection with acetic acid. We put some chemical on your cervix, just acetic acid vinegar.
Is it done at the clinic, or somebody can just do that at home?
So there are some tests that you can do yourself. There are some tests that has to be administered by a healthcare provider. Most of the tests, unfortunately, now are provider-initiated tests. It means that somebody has to do the test for you. However, the good news is that now when it comes to HPV itself, there are some that we can do self-test. So if I quickly go through the types of screenings, there are ones that we look at your cervix, we find out, does anything look like a change? What changes is it? Can we do something about it? There are times that we would now test for the virus and say, are you virus positive or are you virus negative? And if you are virus positive, what can we do? And that's HPV virus testing. And it can be done through what we call the liquid-based cytology, or the almighty pap test that we all hear about.
Why have you given it an almighty?
It is a common test that every woman should have at least undergone, yet we do not. Everybody knows about a pap test, if I'm not mistaken.
Yeah.
But it's as if it's reserved for other people. We don't consider the test for ourselves. Consider it for the poor woman, for the woman cannot afford. We always think that cancer is for somebody else's problem, forgetting that disease
so close.
It does not, you know, it doesn't give an inkling before it comes.
Yeah.
And that is something else that cervical cancer has. You can have the virus and not show any symptoms. By the time you are showing symptoms, there are severe changes that are occurring on the cervix that already may indicate you have the cancer. And like I said, when you have the cancer, pretty much it's not much we can do for you unless we catch it at the very early stages.
So at what age should we do a pap smear?
So pap smear or cervical cancer screening tests starts anywhere from 21 years. 21. There are different kinds of tests. When it comes to HPV testing, we say anywhere after 30 years. So we do pick the test because I mentioned that HPV can self-clear by itself, the body can't clear it. We give it time to clear. And so we reserve HPV testing for above 25 or 30 years, depending on your immune status. All right. But for other tests that we do for cervical cancer, we can start the screening as early as 21 years. And the frequency of screen depends on the kind of test you do. And so when I say frequency of screening is looking for the problem because of the problem.
Right.
So when we look and we say there is no problem, you still have to come back and look again because you are constantly exposed to the thing that can cause the cervical cancer. You are constantly at...
How often?
So if you are doing regular screening by a pap or liquid-based cytology, your interval is somewhere between 3 to 5 years, depending on whether you are negative and how many times you have screened and negative. If you are doing HPV test, your screen intervals is somewhere between 5 and 10 years, depending on whether you're HPV negative and how many times you've done that test. So you see, it is not like we're asking you to come every 6 months or every month for a screen. Yeah. We just need you to at least do some few screens. Let us be honest. There is a particular target now because the world knows we are low resource settings. Yeah. You know that we don't have the money to do everybody's screening. So we are advocating for at least 2 high quality screens for women between the ages of 35 and at 45. Okay. So even if you can do an HPV DNA test at 35 and repeat it at 45 if you're negative, it is good. Like I said, we have 1 to 20 years. So if at 35 you were negative, your minimum, I would see anything, is between 5 and 10 years. And so if you come back in 5 to 10 years, you can have a second test done. And I can tell you, and we don't screen for life. You get to a certain point when you have several negative, post 59 years, we would stop screening.
Oh, okay. Wow. But as you have been talking, it means that cervical cancer is meant for only women. Or we have men.
Well, when I mentioned HPV and its problems, I said it affects every epithelial cell, all right? Okay. It loves epithelial cells. Okay. And so when it comes to cervical cancer, because cervix is the mouth of the womb, if you don't have a womb, you don't have a mouth of the womb. Exactly. And so therefore you cannot get cervical cancer.
I get you.
However, because HPV likes epithelial cells,
right?
Throat, penis, anus, vagina, any of these areas can have cancer. Okay. So once you have HPV in those areas and they persist, you can get cancer.
So it can harbor in these areas.
Yes, it harbors in those areas.
So when it harbors in these areas, and let's say a man has HPV on his epithelial cells on the penis, and a woman doesn't have, will the man expose it to the woman, or I mean, how?
That is where the sexual exposure comes from. Okay. When I was beginning, I said HPV is mainly transmitted through sex, even though you can have asexual transmission. And I said that, so if you are a man and you have HPV, you can give it to a woman. You asked me about some of the risk factors, and I shelved it for later because I'll try to introduce what the whole thing was. Okay. But this is where we come into when we talk about risk factors, what we call multiple sexual partners. Okay. Now, whenever we say multiple sexual partners, most women will relax and say, oh, but I only have one partner. I have my husband.
But your husband might be having other partners.
So as long as the partnership is beyond, as you have correctly said, if one party has multiple partners,
you're in trouble.
There is also the less talked about what we call serial monogamy, whereby within a space of 10 years, you've dated 5 men.
5 men.
That is 5 men exposed.
Or the other way around.
That is 5 men you could have been exposed to.
Yeah.
And each person comes with a risk.
A risk.
So the more total lifestyle partners you have, and I don't mean the women and the men and the women as well.
Yeah.
So the more total lifestyle partners you have, the more total current partners you have, then your risk goes up.
Yeah.
There is also the risk of what we call early birth, because early birth early age at birth presumes that there's early age at sexual contact. So early sexual contact becomes a problem. Because early sexual contact exposes your cervical epithelium, which is not well developed, to the virus. And the virus can cause more havoc. Then there is also exposure to smoking, which can cause a problem. And sometimes it's also known that long-term use of some contraceptives can also risk you.
Wow. Anyway.
Yes, when I mention it, it will be a problem.
It is. But you know, we are always advocating for the use of contraceptive to space your bed, to manage your family. And so if one uses mostly the hormonal ones, right? Doesn't mean the person gets exposed.
It is a combined hormonal. If you look at all the contraceptives, the combined hormonal is not a majority. All right? It is a subset of it. And it is a long exposure. So it is not just one-time use, a 2-year use that is exposure. And do not forget that we in the health space do not lie to our patients. And so when we tell you that this is a potential risk, a risk does not necessarily translate to an actuality. So when we tell you it's a potential risk, then we advocate and advise you to follow your screening modalities.
Right.
It also means that if that risk happens to happen to you, you will catch it early. So you realize that for the women in our space, they are the ones who are actually being protected because they hear the advice, they go for the screening, they catch their problems early, they get early treatment. So when I mention it, I just want people to be aware of that. Follow the safe practices.
Oh, right. Can someone have HPV and not know? How will the person know? Like for both male
HPV will not come with a rash like chickenpox would. That tells you that, hey, I have the disease. You would have HPV. You will clear it and not know about it. Until you go for the test, you will not know you have HPV.
So how about the men? How do they go for the test?
The same thing. Unfortunately, for the men, the yield is not as good. And so even though there are tests for men, it may come with some false negatives. You may do the test, it may tell you are negative, but you may not actually be negative. It may be false. Because the test is not so strong at picking the positivity in the men as it is for the women. And so we advocate, that is why you see the focus is mainly on the women, because currently they have the higher burden of disease. And so we are putting a lot more focus on them. And also because the current tests that we have a better predictability for them. So that's how we say it. You will not know you have the HPV until you go for the test.
But the men's own, they'll be hiding it behind. So does it mean that a man's partner, female partner, might be the one to tell whether there is HPV?
Currently, in most instances, yes. It is the women who are going for screening who are discovering they may have the virus, and then would want to find out what is it they can do for both partners. There are different subtypes of HPV. So subtypes mean that the virus is there, and there are different subtypes and their subtypes are grouped into two main categories, what we call high risk and low risk. So it's the high risk ones that end up causing the cervical cancer. And we talk about two main high risks, the HPV subtype 16 and HPV subtype 18, as causing about 70% of the causes of cervical cancer, whilst the other high risk types, and there are about 13 different subtypes belonging to the high risk group.
The high risk group.
Right. And all these, when you put them together, form about 90% cause of cervical cancer. Now, if you come to the low risk type, we have what we call genital warts, the almighty genital warts. And that's 6 and 11 subtypes is what is responsible for genital warts. And so, yes, you may have somebody who comes to you with genital warts, and then you may now have to wonder if they are also exposed to the other higher risk subtypes. When it came to the causes as well, a history of sexually transmitted disease could indicate that once you had one type of sexually transmitted disease, you could have the other type, which would be the HPV as well. And so we encourage all women who've ever had an STD as well to screen for the HPV to find out if they are negative and find out what to do about it if they are positive.
We're encouraging all people who have had that. Okay. But at what age do you recommend that we do the vaccine?
Okay. So there are three prongs or three targets in the fight against cervical cancer, all right? And the very first target we talk about is vaccination, all right? We want to vaccinate before we are sexually active.
Catch them young.
Because then the vaccine gets to do the work it's supposed to do and mount the defense mechanisms ready to meet the virus in case you meet it in the future. And so currently, you realize that Ghana rolled out its first HPV vaccination. And for us
last
in the
year,
space, we were happy.
Excited.
October last year,
Exactly.
we had our young girls going for the vaccine. And a lot of people
But
were
I
like,
hear
"They're not sexually active."
was not too high.
Because maybe, as you said, we are not understanding the problem as it is. If the parents do not understand the problem, why would they send their young children to go and take something that is foreign that may harm them?
Yeah, there were some myth even about it. People even said it will affect their future reproductive health issues. And that. So what do you
When
say?
it comes to vaccination, a lot has been said.
Okay.
Unfortunately, I will not say that everything done in the medical space is 100%. There is nothing in this world that is 100% safe. Everything comes with some small caveats, all right? And human beings also do associations. If I walk barefooted and I have leg pains, it is the barefoot walk that brought the leg pains, even if the leg pain was waiting to come. And so we don't do associations, all right? It is there.
Yeah.
HPV vaccination is known to be safe. We wouldn't risk our young girls from 9 to 14 to receive the vaccine if we thought it was a problem.
Yeah.
And we are trying to do that before they are sexually active, before they are exposed to the actual virus. So we give them something that mimics the virus, that will let the body mount an immune response and now protect their cervix from the virus when the virus comes. So the vaccination is as early as 9 years to over 14 years for what the government program was running. And the vaccine is still available. If you need a vaccine and you go to the centers that are administering it, they would give it to you.
So people
Beyond
can just
that-
walk in to go and do that?
Yes, please.
Okay.
Beyond that, we also have vaccine for everybody all the way. We are advocating for pre-sexual contact.
Can we do vaccine for men too, since they also carry the virus?
Actually, there are some countries which have achieved eradication of cervical cancer because they vaccinated their girls and their boys young.
Okay.
The assumption is that the boys are the ones having sex with the girls.
Exactly.
So we target both. But you see, we are a poor resource country. HPV vaccine can be expensive. And the government has done a marvelous job by availing it to our young girls. And the target was 2.4 million people. Average market price for HPV is ranging between somewhere, the vaccine, somewhere between 750 cedis
No, but
to almost 1,500.
if other countries have been able to eradicate it, I think we should channel our resources towards these things for our younger people, for a better future.
We have started.
Okay.
We have started. And my voice is to tell all parents who could not take advantage of the current exercise that the vaccine is available. It may not be free, but it's available.
Now it's not free?
It may not be free if you're not in the government program. The government program has a particular target. Young ladies from 9 to 14. All right? That is the government's target. That is the government's one. The government has a target of 2.4 million people. It cannot take care of all our girls or all our women. And so we are saying that the vaccine is available for anybody who wants it, anybody who wants to protect themselves. It is not only for young girls. Anybody who wants
who is not
protection.
sexually active.
Anybody who wants protection from human papilloma virus. Sexually active or non-sexually active.
But the person should be negative first.
No.
Oh, then I think you should educate our people so they get to know very well. And anybody, any woman.
So when I was talking about the HPV vaccination, I talked about the fact that we have several subtypes that are responsible for causing the cancer. And I said there are more than 13 high-risk subtypes that cause the cancer. The biggest being 16 and 18. Now, most vaccines that we have target 16 and 18, as well as 6 and 11, because genital warts also cause a disfiguring disease in the genital area, and so we also want to prevent that. So currently, the minimum vaccine we have is what we call the Gardasil 4, because it has 4 subtypes. It protects against 6, 11, 16, and 18. That's what the government is offering. We also have Gardasil 9, which have 9 subtypes protection. The 4 I mentioned, plus other subtypes.
Right.
And so even if you turn positive to, let's say, 31, what about
there will be
the rest?
others that you might
Yes,
prevent.
and so currently the education is that regardless of your HPV status, you can get vaccination because it will protect you from the other ones that you are not yet exposed to. Okay? And so we say it is best given before sexual debut. You get the maximum protection. That's the best work ever. However, even if you are sexually exposed, you will get very good response. Even if you are sexually exposed and HPV positive, you will still get a good response. And so it is not limited to those who are
not sexually active or negative or whichever.
And it's not limited to only women.
So men can also go. Men, you can also go for
especially the young boys before they are sexually active. Then we get the maximum benefits.
Okay. Doctor is saying it, so I'm not the one saying it. So we should all go for our vaccines to prevent or protect us from HPV virus.
Yes,
so,
please.
But what are the statistics for cervical cancer in Ghana?
So globally, more than 600,000 new cases. Globally? Globally. Okay. More than 600,000 new cases. Okay. And unfortunately, more than 300,000 deaths. So half of the people with cervical cancer are dying from cervical cancer.
Oh.
Ghana's adult female population, about 15 years, I would say around 10 million. And out of that, we still have around 3,000 new cases every year, with around 7,008 deaths. So more than half of the people who have cervical cancer are dying.
And if we have the vaccine...
Ghana's statistics of screening is 3%.
Oh, only 3%?
Only 3% of our women have been screened.
Wow.
All right? Wow. So if only 3% have been screened, imagine the percentage that has been vaccinated. Because most times we're doing screening before vaccination. Before the current vaccination for the young girls that has done the mass vaccine, we're doing screening for vaccination. We want to know what you have and know how best to help you, all right?
Yeah.
So if 3% were the screening statistics, then imagine the vaccination statistics.
Very low.
Okay, very low.
Extremely.
And like I said, the reason why we are getting more than half deaths from cancer is because once you have the cancer, once you are showing symptoms, most of the time you have advanced age. What are our symptoms? Irregular, abnormal vaginal bleeding that you don't expect. Pain, low abdominal pain, persistent, not getting better. You have bleeding after sex. You have a malodorous or we call offensive vaginal discharge.
So you're speeding up too much. So
sorry?
Just take your time. You know, I was going wrong. So we get to the symptoms. Then you hate on it so people get to know. So what are the symptoms?
Unfortunately, I'll tell you the symptoms, but I want to reiterate my point.
Okay.
Don't wait for symptoms. If you see symptoms, you have advanced disease.
Oh.
There's not much we can do for you.
Okay.
If you are seeing the vaginal bleeding, which is irregular, which is not your period, it is not expected. If you are seeing bleeding after sex, postcoital bleeding, it is not expected. It is not good.
If you say postcoital bleeding, what does it mean?
Bleeding after sex.
So we are in consulting.
I use both the medical and the layman's terms.
I wanted to use a layman's term.
Yeah, so that's the first one I was trying to explain, that if you have bleeding after sex, and we call it post-sex bleeding.
But you know, sometimes the younger ones, it might be a hymen that is being broken, not necessarily after.
So I expect the hymen break to be one-time event.
So if it's frequent or the second time.
So we don't expect the young person who's having a sexual debut to really worry about the first bleed. That's what I'm talking about.
Okay.
I'm talking about those of us who have a normal life, and normally we don't get cervical cancer in the teens. Like I said, it takes about 1 to 20 years for you to move from HPV positive to cervical, normal cervix to cancerous cervix. Okay. And so even if your sexual debut was 15, I would expect cancer from you somewhere around after 25. That is why our screening starts from somewhere around 21, and HPV testing around 30 years.
Unless the person is being introduced into sex at a later age.
And so I would advocate we should delay our initiation as much as possible. One of the things we advocate for is delayed sexual debut, prevent early pregnancy, prevent early sexual exposure. And so
STDs,
your cervical epithelium has developed robust well before you attack it with all these other things. Okay.
Oh, so the fight and the friction and everything. Okay.
So the symptoms, as I was explaining, the pelvic pain, when you have low abdominal pain persisting all the time.
Yeah.
That can be a problem.
I am so much particular about the symptoms. So just pause for a moment. We'll go for a short commercial break. And after that, we'll discuss the symptoms, how to manage it, and people who have it, what to do. Okay. So stay tuned, don't go anywhere. We'll be right back after the short break. Welcome back to Consulting Room 5 with me, your host, Dr. Sue. We're discussing cervical cancer with Dr. Ayete. All right. Yes. Yeah. But I want to remind ourselves that this show is brought to you by Kivo hot pepper, Kivo 3-in-1 garlic, onion, ginger, and Lozati lozenges. If you have sore throat, don't go anywhere. Just go to a pharmacy and get a Lozati lozenges. And with Kivo, I will not even talk much. Kivo pepper, but anyway, doctor, so we're talking about the symptoms.
Yes, please.
Yeah. What are the symptoms? Briefly, what we said before we went on the short break.
Okay, so briefly, before we went on the short break, I was describing irregular abnormal vaginal bleeding.
Right.
So bleeding that is not what you expect for your menses.
Right.
Out of your menses, what we call intermenstrual bleeding. Okay.
So it's not like spotting, but bleeding.
Well, for us, when we say bleeding, any blood that comes down there that you're not expecting is bleeding.
Okay.
Be it spots, be it actual blood, be it pinkish.
Okay.
We call all that bleeding.
Bleeding.
Because you have seen blood.
Okay.
And so, yes, so it's no, you don't have to wait for the bleeding to be heavy or plenty before you notice. If it's not what you expect and it's not your norm, find out what is causing it. That's the first one. And then we also talked about any instances of bleeding after sex. Every time after sex you notice there's a brownish discharge or there's a pinkish discharge or there's blood actually coming, it is not expected.
Okay.
So that's when you won't find out what is causing it. A few women may have pain, lower back pain, lower abdominal pain, what we call the pelvic pain.
Okay.
And so when you have that pain that is persistent, that is not resolving, also you want to check it out. All right? That being said, you do have a malodorous or an offensive vaginal discharge. And so if you discharge that is not, characteristics of normal discharge is not supposed to be offensive.
Okay.
And normally it is clear.
Yeah.
This one would have a brownish chain, may have a pinkish chain, it will have an offense to it. That should prompt you that something is wrong.
Yeah.
Depending on how bad it is and spread to surrounding structures, then you may have other symptoms. If it eats into your bladder, which is where the urine is stored,
right,
you have the urinary symptoms of maybe some pain when you pass urine or urinating a lot. If it goes downwards into your rectum and inner area, then you may have some blood in your stools. So by the time you are seeing all these things, like I said, advanced disease. And you don't want to wait to see symptom to want to go. Screening is what you do when you are healthy.
Yeah.
To find out, is there a potential problem?
Yeah.
And tackle that. So that is how I don't want people to wait until they see the symptoms before they come to us. I would want people to come. And like I said, if you do high quality tests, high quality tests.
Where do we get these high quality tests done?
So these can be found in any of our reproductive health spaces, in any of our polyclinics, in any of our hospitals. The government
is the main one the pap smear?
Yes.
Okay.
The government fights for cancer, even though it is not having a routine screening program. We don't have a national screening program. We have the tools in our health facilities to be able to do the screenings. And so if you go in and ask for a pap smear, it can be done. The pap smear now, there's also something called the liquid-based cytology. There's a similar kind of pap smear.
But can someone just go in to say, I want to do a pap smear?
That is what I want people to do.
Okay.
It is not the United
At what
Kingdom.
age?
it is not the United Kingdom. You will not get a text message on your phone. You will not get a call. Unfortunately, we are not there yet.
Right.
We expect people to walk in and say, I have come to screen myself.
At what age?
Screening starts from 21 years.
21, as you said.
Yes. And if you are doing the HPV test, the screening may start from 25 or 30 years, depending on your immune status. So if you come and say you want to do screen, we would look at you, would examine your medical history.
Do we do it yearly?
And find out what you want to do.
Do we do it yearly?
Screening is not done yearly. Screening intervals are 3 years if you are doing cytology tests. If you are doing the pap smear, liquid-based cytology, and you are negative, you may be called to come back in 3 years.
Okay.
You don't have to go every year. If you're doing HPV test and you are negative,
right,
you may be called back in 5 years. So I've put the way forward what the global targets for cervical cancer is. And this target we are hoping to achieve by 2030.
Right.
And the target says that we want to vaccinate about 90% of our girls by age 15. Ghana has started.
We'll get there.
We will get there. We also want to have about 70% of our women having at least a high performance test by the age of 35 and by the age of 45. So we are saying by 35 years, at least have one high performance test, and then by 45, at least have one high performance test. If you get those 2 tests and you are negative, we don't expect you to be developing advanced disease or incurable disease along the way. We expect to have caught the problem early enough to do something for you.
Okay.
And we are also saying that what is the point of screening if you can do something about it? So we have a target of 90% intervention. That 90% of the women who have been identified with either a pre-disease or have the disease should be receiving some form of treatment. All right?
Yeah.
And so, as I am here today, I left everything to come and preach pre-cancer.
Thank you.
I need us to understand that the fight will only win if we go for the screens, we catch the disease early, and receive the necessary treatment. If you wait for the symptoms and we have all the issues, then we are managing. If you are lucky, we can treat you, we can cure you, but most of the time we are managing. And any death from cervical cancer is too much. Because we can
too much for us to have any death from cervical cancer when we can just go for a screening.
When you can prevent it.
And to prevent it. So early detection saves lives. Please don't wait. As you watch Consulting Room 5 with me, your host, Dr. Sue, and Dr. Ayete, please kindly go and have your screening done. So the management, let's do the management now. People who were unfortunate to have, who didn't have the opportunity or who didn't know. Today we all know, so please those of us who don't have it, we should take advantage. But those who were not able to do it, how do we manage these people?
Okay. So management can be in several forms. We do have a way forward, and the WHO has put in 2 strategies that Ghana has adopted. One is what we call the screen and treat approach. The other one says we call screen and we triage and treat approach. The screen and treat approach means that if I screen you and I find something abnormal, I go ahead and treat it. The screen, triage, and treat approach means that I screen you, I find something abnormal, I would want to confirm what it is.
Right. And
based on the confirmation, we'll treat it. And so there are screening tests and there are confirmatory tests. And so you hear some women who do HPV test, then we'll tell them, call them back for a second test called a colposcopy. We'll say we are doing a biopsy. Biopsy simply means we're taking a piece of what we think is abnormal, we send it back to the lab to look at the cells and tell us this is the kind of cell we are seeing, and this is the kind of pre-cancer you have, or this is the kind of cancer you have. And based on that, we know the perfect target for it, right? That being said, when there are lesions on the cervix, what can we do? We can burn off those lesions, what we call cryotherapy. We can use a special knife to cut that lesion out, cut the problem away. Most of these procedures are done office procedures. You work in the morning, we leave by morning. It's not the morning, leave in the evening procedure. It's a day procedure, it's an office procedure.
Right.
You work in the morning, you have your treatment done, within 10, 15 minutes you are done. This on the screen is looking at the thermal or the cryotherapy, where we use a particular gun to freeze the cells there, and then the bad cells will freeze off and almost like fall off, okay?
That's how
down.
one way of
doing that.
Yeah.
We have an excision of the whole area that's affected. That is also available. All right. So we have both the excision techniques and the thermal techniques. Sometimes we may be offered major surgery that will go ahead and remove the whole structure in there. And when we cannot do any of that, we also have what we call radiotherapy. We use special rays to hit the cells and try and damage them until they die off. Okay? So if we catch you early, we can do the curative ones for you. You means that me, my sister, my mother, my girlfriend, my wife, my daughters, you see, my grandmothers, that is you. Any woman is what I'm talking about. If we catch you early, we can do something for you. But if
do people survive?
It's too late.
At what age? At what stage?
So any disease above stage 2 can be a problem. All right, especially stage 1 disease is limited to the cervix. It has not even gone out of the cervix. Stage 2 disease is limited to the cervix with a little bit of spread. All right, because there are different levels of stage 2. And then stage 3 disease is when it's spread beyond the cervix. And stage 4 is when it goes to other distant places. Okay, when a disease is confined to the cervix, there's a lot we can do for you. All right, if I can see the disease confined only to the cervix, it has not gone anywhere, we can still do a lot for you. But when you spread beyond the cervix or other surrounding structures, then like I said, we are managing you, and the survival rate is not
very low.
I said more
but
than half of
luckily for us, we had this lady who got to the stage, the 3rd stage, and she survived. I think we should listen to her in few minutes. Just let's listen to her. Yeah.
Mpacho ene nwumre ewie mi nuanom ne madofo me maamenom ene me mma ne sremo yare wo ho pa obi obeka se yare ni ho no oboa senka cervical cancer manya bi a nka menim se yare bi wo ho saa na emse na me ho edodo me kakra na me ba Kwalebu hospital ene omo hwe me omo ye me lab bebre nti eche ne be da di se menya saa kokram awode ano kokram menya bi nti eba saa na ha me pa bi se da na me de na kodu na moje etumi pa sa na me de ba aba behwe sa ama ye me saa test no na nyame anim nie na den me ye wie me ye bibia wie na madam fo no so je me fefe madam Abigail na madam Rose me ye no mo chem se 2 months e beba na omo na me kasa e se me de ba membra omo na me be kasa na me suyo ti me beje e na me de ma wo mo ti omo ma omo bisa me se ye ne den na me se me de miniska da ba bia ti me nim de meye na omo so o mate ti omo hye me tam bisa me famra na omo na me nko omo de me koye e de me koma e de me ko Kwalebu ho na ko ekoye mo ko ye bibia mo ye bibia wieye na mo start ye ebi se omo de wo kokimu ansa na omo de wakoto afidie so wu bewu o na obi ya na wawu obi kwa na waye sei omo ke kan sem bebre me de me nyankopon na me dan ne se bibia obedi manim awurade nso ye madom ma me start kimo me start bibia mahu ade bia mahu sabe kan se malaria kura wunya malaria wo bre enti yare bia ni ho abre nim efisa me ba bia me na me nim bibia sei se me koye test me koye sei enti yare ni edu akire pa enti na ba bia edu no eye se hwa na ye kọ na awurade nso ye madom ma almost start ye no me koye kemo ni wie me ko start afidie so saa omo na oba ya nkyerɛkyerɛ wo start adidi yie no nso bebre ye sei omo be kyerɛkyerɛ oni nyina enti wo start na wandi hunam mu na ye wo ya no na wo ye wadwen sɛ wo benum adura de ma wo bedom no pepepe na wadidi yie wanum nso kama bibia ni ho a ebe ye wo bibia ni ho ebe ye wo me de me start ye no me hu ade bia na eye me wo msa na me fabre mu na so no me hu se bibia koyie me kona me koje me kokimu a obi ahwe me sori ana de opese obisa masem na waba madam adan ye de nyina ye twa yeti adan na wo de wabo wuti ade wuti na ante na msa minim de entra mitinwe nte me ba bia minim hwe na we ya pagya me sa na moto mu kura nwi wo ho no mo da fam no ye nyina ye sere na me so mi da me hu problem bia me moyre o mo so moyre wu ebi moyre ye tum me moyre anya hwe ebi se me nya adwen bi se Sa eduro no ebi sa tete no na yale se na eduro ni ho enti eduro ba na nkofo kasa wo koye eduro na wo bewu a me hunti ase bi ewom ti me de akoma pa no wodo edi akire pa ma awurade so je madom pa ma me ye bibia wie ye bepem nne me mo wure so anye tum miti nuante me ba bia me natural na egu so aye murka kama me bibia anyame.
So that's a survivor who has survived cervical cancer at the 3rd stage. So she was very lucky. And as she has advised, you should go for the test, you should go for screening before it's too late. She is lucky she survived, but you might not be lucky. So doctor, were there some things she did to be able to survive it, or it's just by luck?
Oh, I think adherence to the advice she was given, you know, being able to go through the treatment, coming for her visits, following the doctor's advice, and also having the necessary treatment modality. Ghana is so lucky that people travel from out of other countries to come for therapy in our centers because we have a good therapy center at the college.
Wouldn't that put pressure on our centers?
It does. It does. There is so much pressure. That's why I don't want people to join the pressure queue. There is so much pressure on our centers. But we cannot turn away people who seek health. We cannot say because Ghana has its own pressures, if anybody comes from outside, we should turn them away. No, once you seek health and we can offer the help, we are willing and able, we will offer the help. And so we have the centers, we have the treatment modalities, we have the screening modalities. Let us make good use of it, no matter where we find ourselves in the spectrum, no matter where we find ourselves in that line, whenever we think. It's not the end of the world to be diagnosed with a medical condition. In this case, cervical cancer. It is not the end of the world. It's just that the morbidity is much, much higher when you are diagnosed with it. Women are the lifeline of our households. They are the lifeline of our economy. They're the lifeline of everything we do here. And so when we take a woman from her daily struggles, we are really affecting everybody else in the nation. And so it is very important that they are able to go through this. When currently on the screen, I am sharing with you what the preventive strategies look like and its relation to HPV infection. And as you can see, when you have HPV infection, unfortunately I didn't show it here, but it can regress. And you see the infection is pointing somewhere around 15, because that's where our sexual debut is now at, around 15. And so HPV infection comes in there, and it can clear or it can persist. And when it persists, it follows a red line of staying up there, and then you have the precancer. And you see between 15 and 30 years, we start getting the cancers, all right? And so the persistence of the HPV and the precancer is what we want to target. You don't want to wait until you have the cancer. You want to be able to do a lot of things before we get to the green, which is the tertiary prevention, which is treating people who have the cancer. We want to do the red, which is the primary prevention, and the blue, the secondary prevention, which means that give the vaccination to the girls and the boys, screen the women, and catch the diseases and treat them early before we get to the cervical cancer.
Interesting. What can schools do? What can parents do to prevent these cancers? So,
as a parent, your duty is to your children, your duty is to yourself. If you are a father and you have a wife, your duty is to make sure that she goes for her screening, she gets her vaccination. If you have daughters, you have sons, your duty to them is to make sure that they adhere to their vaccination schedules, they come for the vaccines on time, they get to the centers that can vaccinate them. If you have sisters, your duty is to advise them to go for that. If you have mothers, your duty is to advise them.
So we should advise.
Everybody has a duty.
It's our sole responsibility.
That is why we are doing our bit. You have invited me to do the talk, and I'm doing my best to educate. And I thank you very much for allowing me into your consulting room for us to have this wonderful discussion.
You are always
very
welcome,
important to everybody and to our women. And so
we are happy
that
to have
is
you.
what I would say.
We are happy to have you. And we really love what you are doing. We have learned so much today. We didn't even know that some men carry the HPV, and even men should go for the vaccine as well. You know, so it's not only women's business, yeah?
No, please.
Yeah.
The vaccine, let me iterate, the earlier the better.
But
the schools can allow the girls to go for the vaccine.
Right.
Schools can allow the girls do the education in the schools. If our parents and
like
PTAs will allow.
Is it high schools?
So we are catching them before sexual debut, and we are doing them between 9 and 14. By 9 years, we are still in JSS.
JSS is high school too.
High school,
junior high school. junior high school.
Yes.
So it's
that's
also
where we are starting
school.
from, right?
Yeah.
And we are going all the way to 14, 15 years and making sure that they can get the vaccines.
Okay.
So the schools can have the talk, the schools can advise the girls, the schools can help the young ladies, you know, stay, as they say, late sexual debut.
Yeah,
abstinence.
Right? Yeah,
and
abstinence.
if we have to start the sex, the risky sexual behavior should be avoided.
Right.
Right? The safe sexual practices must be preached. Okay?
Okay. Okay. So we should delay in the initiation of sex. We should also go for screening for males, females, catch them young. We should go for the vaccine, especially our young people. Doctor, in about 1 minute, tell us, our take home, what we should do exactly today, all that we have discussed in about 1 minute.
Okay, so I would say that we shouldn't wait for January to know cervical cancer.
Right.
The cervical cancer is a lifetime problem, and so all year round we are available to offer any service related to cervical cancer, from vaccination to screening to treatment. Walk in, just say, I have come, I want to be screened, or I want to be vaccinated, and we will sort it out for you. It is important that we take this period to talk about it, because it is a good avenue to remind people, for those of us who are falling asleep, to wake us up and to join the fight against cervical cancer. But let us not wait for January. It's a year-long issue, anytime, anywhere. See your healthcare provider, see that doctor, see that nurse, see that healthcare person that you related, ask the questions, talk about it, and we are always ready and willing to help you.
Thank you so much, Dr. Labi, or Dr. Ayete, which of them, any of them. Yeah, so, but I will do Kweku. Forgive me. Thank you so much for coming here to give us all this information. And we hope that we'll minimize the social media thing we are always doing. So we concentrate on our health and our well-being. We should disturb the health service providers with all these things. And it's going to go a long way to help us in our health. Cervical cancer is preventable, but it's only preventable when you go for the screening or you do the vaccine. So thank you very much, Doctor. But this show is brought to you by Kivo. Kivo pepper, Kivo 3-in-1, garlic, onion, ginger. And they are saying that they are giving you this beautiful gift. So you go and they are all natural. They are all very, very natural. So Kivo is saying thank you for coming here, coming to teach us on cervical cancer. And also, the show is also brought to you by Unicorn Chemist, who are the main producers of Lozati lozenges. So when you are in your consulting room and you feel that your throat is itchy or dry, just get Lozati lozenges and then just take some lick. It will soothe the throat very well. Thank you, my sponsors, Kivo Lozati lozenges, and also my beautiful outfit. Very beautiful. This one is for Sacrum, you know, made in Tiche Couture. It's from Kumasi. They just looked at me and then they made a very beautiful outfit for me. So thank you, in Tiche Couture. Get your outfits, contact them on 0244364095. They will make a very beautiful outfit for you. You know, they just saw me on the screen and then they made this nice outfit for me. So it means that if you call them, they can easily do a very beautiful outfit for you. Thank you, everybody, for having us. Cervical cancer is preventable. Let's do the screening, let's do the vaccine, and let's help people who have these cancers also manage it well. See us same time next week. We'll come your way. Stay healthy, stay blessed. Bye.
you.